Community Analysis of Plant City by Leslie Carlisle. This presentation will begin by presenting a brief historical overview of the city and will also present a community analysis that will include the structure, population, comparison of health concerns, adequacy of health-related resources, environment, and government and public policy of the community. Lastly, this presentation will prioritize 6 community problems as perceived by a community nurse. Plant City was originally named Ichpuksasa, which was the name of the Indian village that had once lived in this territory. An Irish postmaster renamed the village Cork because people were having so much confusion when it came to the spelling and pronunciation of Ichpuksasa. Henry B. Plant lengthened the South Florida Railroad into the town in 1884, and in 1885, when the town was established, it was renamed in his honor. Today, Plant City's boundaries consist of 28.43 square miles, and the city has a population of 38,938 residents. Plant City started out as a large cotton center. However, today its biggest crop is strawberries, which has earned it national recognition. Over 3/4 of the United States strawberries are derived from Plant City, and it has become so big that every winter Plant City hosts the Florida Strawberry Festival. The housing of Plant City is comprised of a mixture of condos, apartments, housing developments, and single-lot homes with acreage, which adequately meets the demands of the community. Plant City has a housing authority board, which runs 200 public housing units within its area of operation. The mission of the housing authority is dedicated to providing safe and clean rural dwellings, apartments, or other living accommodations for residents that have low income. First United Methodist Church of Plant City participates in a 13-church collaboration that helps to provide temporary housing to homeless families in the community. There are over 10 public elementary schools and 5 public middle schools, along with multiple private schools located in Plant City. There is only one public high school called Plant City High School. This makes Plant City more than capable of meeting the educational needs of its residents. Plant City also has one public library called the Bruton Memorial Library, which offers free services to Hillsborough County residents. The library is a 21,000 square foot facility that offers events and services for all ages. The library also houses 3 conference rooms, a study or teaching space, a screened-in gardening space, and a community room. As you can see, this library is more than capable of offering the needed services to the residents of Plant City as compared with other libraries in surrounding areas. Plant City has one recreation center called the Plantine Recreation Center. Plant City promotes health and wellness at this facility by offering free special interest classes and a summer youth program. The center sits on a little over an acre and is equipped with a playground with pavilions and picnic tables. The center also has 3 meeting rooms along with a kitchen that is available for rent. The hours of operation are 7 a.m. to sunset 7 days a week. This center helps to promote physical activity and wellness through its different free classes and programs. There are a different variety of local gyms and the Plant City YMCA that offer different options of physical activity for residents. However, these places cost different fees depending on the locations and can be a hindrance to the residents' motivation and possibilities for health and wellness. Plant City offers multiple different museums in the city for its residents also. The first museum is the Union Station Depot and Train Viewing Platform, which is a historic facility located in downtown Plant City that was built in 1908. The museum offers a brick passenger depot and a railway loading dock. Another museum that boasts Plant City's cultural heritage is the East Hillsborough Historical Society Museum. This museum is devoted to preserving historical heritage of Plant City and offers exhibits for people to look at. The community focuses on its heritage to an extent that has caused younger residents to seek a more youthful area to reside. In this community, 26.5% of the population is under the age of 18, which is higher than both the county and state population numbers. This age group is more at risk for obesity, alcohol and tobacco use, accidental deaths, and suicide. In a window survey of the community, younger residents can be spotted smoking and riding 4-wheelers without helmets, which demonstrate the risks taken by the community members and their need for education and prevention. 30.3% of the population of Plant City is Hispanic or Latino, which is greater than surrounding areas including the state of Florida, which is mostly due to the need for farm workers. According to the CDC, Hispanics have an increased risk of developing cancer, high blood pressure, heart disease, and diabetes. This ethnic group is at a greater risk of these health problems due to many factors including lack of health care insurance, language barriers, lack of education, and higher incidences of tobacco use. This shows the need in the community for increased education and outreach for the Hispanic population. Plant City is a community lacking in education, with 21% of the population only having a high school education. It has been shown that there is a direct link between the amount of education a person has and the healthier they are, related to their ability to reason, basic knowledge, and emotional regulation. This demonstrates the need for education and promotion of health in the community. The top communicable disease in Plant City is sexually transmitted diseases like chlamydia and gonorrhea, and is similar to surrounding areas, including the state of Florida. Sexually transmitted diseases are extremely common, yet are preventable if residents are educated effectively on how to protect themselves and their partners. The top causes of death in Plant City are cancer and heart disease, much like Hillsborough County. These health problems are a direct result of the use of tobacco products in the community and making poor dietary choices. Plant City has one hospital in the community called South Florida Baptist Hospital, which is a 147-bed hospital that delivers acute care in a small and friendly environment to the residents of the community 24 hours a day, 7 days a week. Most insurance carriers are accepted there, including Medicaid and the Hillsborough County Health Plan. One facility that offers both assisted living and skilled nursing to not just the community of Plant City, but all throughout the state of Florida, is Solaris. The location in Plant City serves the community, and costs vary depending on which medical insurance a resident has, and the facility is open 24 hours a day, 7 days a week. The Brandon Regional Hospital Emergency Center is an ambulatory center which serves the residents of all ages in Plant City 24 hours a day, 7 days a week. All residents are accepted, however, costs will vary depending on the insurance carrier being used. Grace Point of Plant City is a 24-hour mental health crisis center that accepts patients of all ages at any time that are having a mental health crisis. Costs vary depending on health insurance coverage, but they also accept private paying patients. These are the Healthy People 2020 objectives chosen for the Plant City community. The objective TU1 strives to reduce the use of tobacco by adults. This objective was chosen due to the visual observations of tobacco use during the window survey and the incidence of tobacco use by Hispanic residents, which show a need for improvement in education. Objective AHS-5 is aimed at increasing the amount of people of all ages that have a specific place where they receive consistent primary care and education. This objective was chosen for this community because of the lack of education and care that the Hispanic population is participating in, which accounts for 20% of the population. The number of health risks to the community can be greatly reduced if the number of residents that had ongoing care was increased. Objective SA-14 aims at reducing the number of people of all ages that engages in binge drinking of alcohol. This objective was chosen for this community based on the window survey, which revealed easy access to a number of bars with residents drinking excessive amounts of alcohol. Plant City adequately provides a variety of environmental resources to its residents. There are a variety of parks and recreation centers that provide efficient and useful programs to meet the varying wants of the residents. The parks help to encourage active and passive community involvement in recreational prospects. The Plant City Community Resource Center offers free classes and activities for adults and youth in financial assistance and rental and housing assistance. The center also offers free activities for seniors so that they can gather, learn, and enjoy each other. The Plant City Police Department and Fire Rescue work together to provide necessary needs for the community, like response to fires and medical emergencies, to help maintain order and improve the lives of the residents. The Fire Department offers multiple community programs, inspections, and educational opportunities to help meet the educational needs of the community. The Utilities Department of Plant City encompasses water, solid waste, and sewage disposal. Residents have the option to take advantage of the use of reclaimed water for irrigation, and recycling pickup is offered once a week. Plant City prides itself in its water program, and residents are able to easily access different city water information on the City of Plant City website. During the window survey, 2 areas of concern were noted in the environment of Plant City. First, the condition of the roadways revealed multiple holes and cracks throughout the community, along with extremely rough railroad track crossings, which can cause financial problems to residents if these conditions cause damage to vehicles. The other area of concern noted is the lack of vector control programs in the community. During the window survey, many different species of animals were noted to be wandering freely, especially the farther out from town. This can cause potential risks from animal attacks, infections, and damage to personal property. The community of Plant City is led by the City Commission, which consists of the mayor, a vice mayor, and 3 commissioners. The officials are easily reached by email and guarantee an answer within 24 hours. There are City Commission meetings twice a month, which usually are well attended by the residents of the community. The agenda, minutes, and other informational resources can be easily accessed on the City Commission website. The budget allocation for Plant City is divided to supply all aspects of the community, including environment, community development and investment, safety, debt services, and fleet replacements for the city. There are no area concerns for this community based on the data because all areas of the city are adequately addressed by the political members governing the community. In the community of Plant City, cancer is the leading cause of death, responsible for 22.3%. This number is directly related to the visible number of tobacco users observed during the community window survey. Also, considering a majority of the residents of Plant City are farmers, this cancer incidence can be contributed to them working outside without adequate sun protection. Another problem in the community of Plant City is the accessibility of free or income-based healthcare services to low-income residents. A majority of the population in Plant City is derived from Hispanic migrant workers that work in the farm fields and don't have healthcare insurance. Free healthcare clinics are located in western Hillsborough County, which can deter residents from seeking the needed medical care for their health problems. In the community of Plant City, there are a multiple number of bars available to residents which promote the excessive intake of alcohol. Excessive use of alcohol has substantial risk, including injuries, violence, cancer, high blood pressure, and mental health problems, all of which can be detrimental to the health of the residents of the community. A fourth problem in the community of Plant City is the use of tobacco products. During the window survey of the community, it became obvious that smoking and the use of smokeless tobacco products is a big issue. Smoking is the primary cause of preventable death and leads to disease in the body, causing harm to nearly every organ. This problem presents the task of education and prevention need in this community when it comes to tobacco use. In the community of Plant City, a fifth problem identified is the lack of homeless shelters available to residents. There are shelters available in surrounding communities of Hillsborough County, but that can deter homeless residents from being able to get access to the available resources due to distance. In the window survey, there were multiple instances where homeless individuals were spotted in the community. A sixth problem identified in Plant City is some of the reckless behaviors observed in the window survey. These behaviors included riding four-wheelers without helmets and residents crossing the street in a non-designated crosswalk. Unintentional injury is the third leading cause of death in the community, accounting for 6.2% of deaths. These types of reckless behaviors can lead to injury and possible death of the residents and show a need for education and prevention in this community. The list was prioritized according to death statistics from the county website and by the actual observed behaviors witnessed during the window survey.